Let us discuss about acute supurative otitis media or ASOM. What is this acute supurative otitis media or ASOM? It is inflammation of middle ear or infection of middle ear by pyogenic organisms. Remember this, okay? This is inflammation or infection of middle ear by pyogenic organism. This is common in children and this is common in low socioeconomic status. Okay, low socioeconomic status. Let's see how this develops. So as I told you, there is infection of middle ear, right? How does this develops? How, from where does this infection comes? This infection comes through eustachian tube. Through eustachian tube. How does infection comes through eustachian tube? When there are recurrent attacks of upper respiratory tract infections, this infection spreads through eustachian tube to middle ear, or this infection can spread through uh, tympanic membrane. That means if there are infections in the external ear, this can go through the perforation in the tympanic membrane, okay, to the middle ear. Okay, so how does the infection develops in middle ear? The infection comes through eustachian tube, right? When there are upper respiratory tract infections recurrently, or it can spread through tympanic membrane. Okay, so this is how it develops. Very rarely it can also develops from blood borne. So this is how it develops, right? So not only upper respiratory tract infection, even infections of tonsils, nasal allergy, and tumors of nasopharynx. In all these conditions, what happens is infections will spread through eustachian tube to middle ear. Clear? Even when there are infections in the external ear, it can go through the perforation in the tympanic membrane to the middle ear. Clear? Now let's see how this develops. First, as I told you, there is inflammation, right? This inflammation in the middle ear will undergo four stages. The first stage is stage of tubal occlusion. Second stage is stage of pre-suppuration. Third stage is stage of suppuration. Fourth stage is stage of resolution, and last stage is stage of complications. If we don't treat it, stage of complications. So let's discuss each one of these stages. As I told you, first stage is stage of tubal occlusion, right? How does this tube get occluded? We'll see this, right? So initially there will be inflammation of middle ear, right? This inflammation, what it does is it causes hyperemia and oedema of nasopharyngeal end of eustachian tube, right? Of nasopharyngeal end of eustachian tube, right? So due to inflammation or hyperemia and oedema, nasopharyngeal end of eustachian tube will be occluded, right? So as there is occlusion of eustachian tube, what happens? Negative intratympanic pressure will develop. Negative intratympanic pressure. Due to this negative intratympanic pressure, tympanic membrane will be retracted. Tympanic membrane will get retracted, right? Okay, I think you understood why there is retraction of tympanic membrane in the in ASOM. It is because eustachian tube will get occluded. This results in negative pressure development in the middle ear, that results in retraction of tympanic membrane. Clear? So the first sign that we see here is there is retraction of tympanic membrane. Clear? And there will be some degree of effusion in the middle ear, but this cannot be seen. This is very very mild. Okay, other symptoms include there will be deafness, there will be earache. Okay, and annular malleus will assume its horizontal position. Handle of malleus will assume horizontal position. Okay, so what are the things that we see in the stage of tubal occlusion? There will be retraction of tympanic membrane, effusion, deafness, earache, and malleus will assume horizontal position. These are the things that we see in the stage of tubal occlusion. Now let's move to second stage, that is stage of pre-suppuration. See, let's see what are the things that we can see here. Now in this stage what happens is pyogenic organism will start invading. Okay, now pyogenic organism will come into play. Due to this what happens is there will be hyperemia of mucosa, right? Due to this hyperemia there will be congestion of tympanic membrane, right? Tympanic membrane. Clear? And this is what we see in the stage of suppuration. Then what are other things that you can see? Other things are earache. It's very very severe. Okay, severe earache will be there, and there will be thrombing type of earache, and there will be hearing loss. And what are the signs we can see here in the tympanic membrane? What we see is this: if you take this annulus malleus, along this annulus malleus you will see blood vessels, and in the periphery also you will see blood vessels in the periphery like this. So due to this it gives cartwheel appearance. Clear? So along the annulus malleus and the periphery of tympanic membrane we will see the blood vessels. This gives the appearance of cartwheel appearance. Okay, and these are the things that we see in the stage of suppuration. What are the things that we see in the stage of suppuration? One, we will see congestion of tympanic membrane, and in the tympanic membrane we will see one more thing, that is cartwheel appearance, right? And what are the other things that we can see? We will see pain, we will see hearing loss, and these are the things that we see. Okay, so next we'll see the stage of suppuration. Let's see what are the things that we can see in stage of suppuration. Okay, stage of suppuration. Clear? In stage of suppuration what happens is pus will get accumulated in the middle ear. We'll see pus accumulation. Okay, and there will be severe ear pain, hearing loss will be there, and if see tympanic membrane you will see redness. Okay, red tympanic membrane, and this tympanic membrane will be enlarged. That means it will increase in the thickness. Clear? And there will be yellow spot on the tympanic membrane. That is because here tympanic membrane will bulge out, right? Okay, due to this bulging, the point where there is maximum bulging, at that point you'll see yellow spot. Clear? So whole tympanic membrane will be bulged out and it is red in color. At maximum bulging we'll see yellow spot. Clear? There will be earache, hearing loss. Clear? So these are the things that you can see in stage of suppuration. Next, let's see the stage of resolution. In the stage of resolution, what are the things that you can see in stage of resolution? In the stage of resolution, what happens is tympanic membrane will get ruptured. Tympanic membrane will rupture. Due to this rupture of tympanic membrane, pus will comes out, right? As the pus comes out, then all the symptoms will relieve. Symptoms will be lost. That means there will be there will be no hearing loss, there will be no earache. All these things will happen, right? So these are all things happening just because the pus comes out because of perforation, right? So all the symptoms will be relieved. Clear? Now if you see in the external layer, you will see pus, right? Or sometimes blood, even we can see blood also. Okay, so due to rupture of tympanic membrane, all the pus will comes out and all the symptoms will also get relieved. Clear? Now we'll see the stage of complication. Stage of complication. In the stage of complications, what happens is, if we don't treat the condition, or if the virulence of the organism is very high, then it results in complications. What are the complications that we can expect in this condition? One is facial paralysis. Facial paralysis can happen. Facial paralysis. Then we can see mastoiditis. Mastoiditis. We can see subperiosteal abscess. Subperiosteal abscesses. Clear? We can also see meningitis. Brain abscess. We can see lateral sinus thrombophlebitis. See, all these things can happen if you don't treat the condition. Clear? So let's once again revise the stages. What are the stages we have? We have 5 stages, right? First stage is stage of tubal occlusion. What are things that we saw in tubal occlusion? We saw congestion of tympanic membrane, right? Congestion of tympanic membrane and retraction of tympanic membrane, and on the tympanic membrane, annulum malleus will assume horizontal position, right? And there will be earache, there will be hearing loss. Okay, all these things are observed in stage tubal occlusion. In the stage of presuppuration, what are the things that we saw in this stage? We saw earache, hearing loss, and we saw cartwheel appearance, right? Cartwheel appearance. Clear? These are the things that we saw in the stage of presuppuration. In the stage of suppuration, what we saw is, we saw hearing loss, earache, and we saw bulging of tympanic membrane, and we saw redness of tympanic membrane, and we also saw yellow spot. Clear? In the stage of resolution, what we saw is in the stage of resolution, what we saw is, we saw perforation, right? We saw perforation, pus comes out, symptoms are relieved, and in the external ear, what we saw is pus or blood. Clear? These are the things that we saw in the stage of resolution. In the stage of complications, we saw the complications, right? Like mastocytitis, facial paralysis, labyrinthitis, petrositis, extradural abscess, meningitis, brain abscess, lateral sinus thrombophlebitis. Okay, these are all things that we saw in the stage of complication. Next, let's see the treatment. So as it is something related to microorganisms, so we give antibiotics, right? Antibiotics. What are the antibiotics that we can give? As the most of the organisms is streptococcus pneumonia and Haemophilus influenza. So what we can give here is ampicillin, and we can also give amoxicillin, and if the patients are allergic to these drugs, then we can give cefaclor, cotrimoxazole, clear, and we can also give erythromycin. So first, what are the drugs that we can give? Ampicillin and amoxicillin. If the patient is allergic to these drugs, then we can give cefaclor, cotrimoxazole, erythromycin. Clear? If the organisms are Haemophilus influenza, if the organism is Haemophilus influenza, then what we can give is clavulinate, amoxicillin, clavulinate, right? Amoxicillin, clavulinate, augmentin, cefuroxime, cefixime. Okay, these drugs must be continued for 10 days. Clear? This must be continued for 10 days. Then what are the things that we can give? We have to give decongestants, oral as well as nasal. Okay, oral decongestant, nasal decongestant must be given. Then we'll give analgesics, antipyretics, and we have to do ear toilet. Dry local heat must be given. Dry local heat must be applied, and myringotomy can be done to drain pus. Okay, what is that? What is that? Myringotomy. Okay, myringotomy is done to drain pus. Clear? This is something about ASOM. Please go through your textbooks before going to exams. Okay, thank you for watching.